Stages of healing after extraction? Oh, ये तो जानना चाहिए. Let's actually know what really happens when your dentist sends you home with that gauze in your mouth after the tooth extraction. Knowing the healing phases can make a world lot of difference in the healing process. Day 1. What's happening? Your body is jumping into a natural action and it forms a protective clot. Now, this protective clot is formed in the extraction socket. It is a natural mechanism, that is, it is a natural bandage which shields the underneath bone and the nerve endings. You lose this clot and you will end up a painful condition we dentists called as dry socket. And I assure you, you would never want that. Day 2 and 3. Swelling is usually at its peak at the early healing phase. By now, your body is working overtime for its repair. But if there is slight discomfort, it's quite normal. If there is sharp pain, please keep an eye out for it because it is not normal. If there is any kind of drainage which is unexpected, please do contact your dentist because it is not normal. You'll probably notice a whitish or yellowish layer forming. That is the fibrin and it is very much normal. Day 4 and 5. Granulation tissue begins forming in the empty socket. Day 6 and 7. The sockets get sealed with soft tissue. A week in and you've hit a major milestone in the healing process. Your risk of developing a dry socket drops dramatically now. Your cloth has stabilized and the gum tissue is steadily closing over your socket. Week 2. Socket closure begins. Connective tissue fills the gap. You will see a lot of improvement by now. But always do remember, everyone heals differently, but there will be a lot of progress in your socket closure by now. The tissue may still be pink or uneven in appearance, but it is still actively repairing itself. If you've had stitches, they have already dissolved by now or they are ready to be removed. A mouthwash can be a great addition at this stage. Week 3 and 4. Your gums have already completed their healing stage. Now the tooth extraction socket moves into a new stage of regeneration. The first 3 months after your tooth extraction. As we all know that once a tooth has been extracted, there is an empty space in your jawbone. In these first 3 months, your bone rebuilds and forms in that empty socket. Over a period of time, the bone completely fills the socket, and this is a key feature in your healing process. Moving forward, after the bone is completely formed and your socket is completely healed, the most